What's up, guys? I'm Alan Branch from Project 49, and we're back today with a live interview. And I've got my sidekick and compadre, Dustin Seegers. And we brought back in, once again, my buddy, Charles Rawlings, Dr. Charles Rawlings. He's has actually had and recovered from COVID-19, and he's going to answer some questions because, guys, the news, what we're hearing today is everything is bad. I mean, everything is scary. Dustin and Charles, a little earlier, you were talking about the fear of what's being spread right now. What's some of the latest fear that's been going on in the news, Charles?
Well, what we've been hearing, which is totally expected, are folks having strokes with the virus. And also there's been, I believe, one case of cardiac rupture, heart rupture. This is not unusual. In fact, it would be very unusual if it didn't occur with this virus. The cardiac rupture is probably due to a cardiomyocytes. It's an inflammation of the heart. In fact, many viruses give a cardiomyopathy. In fact, cardiomyocytes, the most common cause is viral infection. Viruses such as Epstein-Barr, adenovirus, let's see, HIV, I believe, does it. Echovirus will do it. Coxsackie virus will do it. They all attack the heart. So this is not unusual. In fact, it would be expected. And in terms of the stroke, the mechanism is typically a change in clotting parameters, and almost all viruses can do that. I just looked up some statistics based on the flu itself. Back in a big study back in 2009 looked at the number of ischemic events that happened with folks with the flu. And in that particular year, there were over 500 strokes associated with the flu, which is about a 1.5% incidence of people with flu having strokes. And they also looked at children. Children who have the flu are 6 times more likely to have a stroke than someone else. So this is not unusual. And if you look at the studies that they're doing, the fellow Oxley, who is actually a part of the neurosurgery community, is doing a paper. I think he has 7 patients. I think there's some other centers that have a few. We're looking at about 22 to 25 patients out of 900,000 that have been infected. So this is what I would consider anecdotal. You can do a case report about it, but it's not surprising. The virus is going to cause strokes, and it's going to cause cardiomyopathy and inflammation of the heart. That's to be completely expected. There's really nothing to fear about it. It's just going to happen. What you need to really fear is the long-term effects of this personal isolation, this lockdown. As we were just speaking, it's suicide hotlines have noted almost 100% increase in volumes. Clinical depression is up close to 50%. Alcohol sales in North Carolina are up 38%. 2 weeks ago, there were, I believe it was 100 people hospitalized in Charlotte, in Mecklenburg, with alcohol-related problems, and 10 of those died. So you've got a 10% mortality rate there. What you're seeing is serious mental health issues from this lockdown, and that doesn't even include things like child abuse and spousal abuse, where folks are in the house together with no escape. What needs to happen is a thoughtful removing of these lockdown measures, because what you're really looking at, Alan, is right now we have quote flattened the curve. What you've really done is basically just extended the time for the deaths. What people need are to basically catch this virus and get some sort of immunity. And now we're also hearing, what I find is fascinating, is this began as let's flatten the curve so our hospitals are not overwhelmed by cases. Particularly in North Carolina, our hospitals are nowhere near being overwhelmed. In fact, they are letting nurses and physicians go because they are not able to pay for them. And then they are actually asking for federal bailout money for the hospitals themselves. So we flatten the curve. Now we're moving the goalpost, and someone's saying, or whoever it is saying, well, we can't let the lockdown go because we may have deaths. Well, that wasn't the original plan. We know we're going to have deaths, and it's tragic, but it's tragic when someone dies in a car accident. It's, we've ruined the economy when we probably didn't need to, if you look at both Sweden and South Dakota.
Well, like I hear, for example, you'll have I was talking to a friend yesterday, and she said, well, I've got a friend that's a nurse, and she volunteered to go work in New York. Of course, our area is not a hot spot here in North Carolina, but she goes to New York, and then the girl comes back and tells us how terrible it is there compared to what she dealt with here. So it's almost like surreal to us, because what we see is our local nurses are like, well, I may not be getting as many hours. They're laying us off, but then a nurse goes from here to New York and then reports back and is like, this is some kind of war zone. What's going on there that's different than here?
Well, New York was the beginnings of the outbreak. It has 10 million or more folks in a very small area. It's highly contagious. They probably don't have the hospitals that they need just for the normal population. So once this spread, the hospitals were going to have an influx of patients. And they may say it was a war zone, but if you actually speak to the physicians that are up in New York, they were able to handle it. They had enough ventilators. They had enough beds. Everyone who needed a ventilator was put on one. Everyone who needed an ICU bed had one. And if you're looking at the studies now, it's showing that New York is almost reaching herd immunity. If you go by the antibody studies, New York has almost 22% of its population that has been exposed, and that's nearing herd immunity.
And so 22% exposed. So what percentage of that is actually has symptoms and in a hospital? Didn't you say it's 80+% of the people had zero symptoms?
Exactly. If you looked at that study, it was about 80%, 82%, I believe it was, had zero very mild symptoms, such that they weren't even sure they had the coronavirus. The average age of hospitalization was 64. The folks that 88% mortality of the folks that were put on ventilators, of those that were hospitalized, almost 100, well, I would say not almost, 94% of them had some sort of a comorbidity, including number 1 was high blood pressure, number 2 was obesity, and number 3 was diabetes.
Well, so the news coming back is always bad. Charles, if you were going to give the positive side of what's going on, what would you say?
Okay, the positive side, and there are many more positive sides than there are negatives. Currently in the U.S., from what I've been seeing and what I've been looked at from the statistics, we have plateaued. We are probably now going to be on the downside of cases. We have gotten the virus's RNA structure. We know its genome. We know most of the symptoms. We know some things work against it, some don't. Sunlight denatures it. Sunlight kills it just like every other virus. And so that's part of the good news. And the other good news is, based on these studies, we know that the vast majority of people who are exposed to it do not become sick. And the ones that we should be protecting, we have identified: the elderly, the immunocompromised, and some of the other folks that have these pre-existing conditions. And so, when we talk about reopening, I'm not one to advocate totally throwing everyone in the pond with the sharks and the riptides. There are people that do need to be protected. The folks that are in the nursing homes, the immunocompromised, the elderly, maybe some with serious medical conditions. They should probably have limited contact with folks. They should be the ones that are wearing the mask. The vast majority of people can go about their daily business. And it's sort of a bridge between the draconian lockdown and the let's throw everyone into the ocean and see if they swim or sink. It's sort of a bridge. It's take care of the folks that are at risk and let everyone else go about their business.
So you give us all the positive things to think about. Dustin, you may have seen it here locally this morning. I get up, I look at the news, and North Carolina has surged, and all of a sudden we have 300 additional cases and all these additional deaths, and it's all over the news. And then Charles, at about 4:55, I brought that up to you, and what did you tell me?
Well, I checked the statistics, and there is a big article out of Mecklenburg that I just read that, oops, sorry, we overestimate, our calculations were wrong. We really didn't have 300, so we've taken 250 back.
After you scare everybody half to death when they wake up and get that in the news before you verified it.
But see, why should that scare people? That's good news. These people are contracting it. They're getting antibodies. They're getting immunity. And if you read, there were only 10 additional deaths. And these deaths are from folks that are in this category that should be protected. So out of 300, you have 10 extra deaths. That's 3%. And you already know that those are in the folks that have these comorbidities and the ones that should be in the protected population.
So Dustin, you are working in physical therapy. What have you encountered? What have you had to deal with so far? Have you had to deal with anybody that's exposed? What are you seeing? How does that affect what you do?
Well, it's greatly affected my patient volume. I probably had 4 to 5 different people over the last 3 weeks that have called and said, "Hey, I'm just not comfortable coming in." And really only one of them made any sense to me. And it was a father with a newborn child. I could understand that, but the rest of them, I didn't try to talk them out of it. But I, just said, "Look, I understand. We'll pick your therapy back up once this started to come around." But yeah, I've got several patients that last week was better, actually. And last week was supposed to be North Carolina's peak week. But I just have found that in general, people just aren't going to come in. I've just started a new clinic. And so I was doing pretty well. I had a pretty good volume of treatments each day. But, once this hit and it really got in the media and everybody's listening to the media, watching the news, they really became fearful. There are people everywhere walking around with bandanas on or masks or some type of something over their nose and their mouth at work. So everywhere you go, you see a lot of that. And if you want to do that, I think that's certainly fine. I'm not against that. I'm not saying don't do that, but I think unless you're actively infected, you need to stay home anyways, and you are. That's a whole nother issue. But it's certainly, definitely, probably not going to keep you from getting it. You still have your eyes exposed, which is one of your mucous membranes. But I just, one of the things I mentioned before we came on is I'm also a bivocational pastor. And over the last week, I've had 3 different folks that I've spoken to who do not go to my church, who are really struggling with probably a low-level depression that's turning into something else. And it's because their life has been upset. I mean, I had one person that told me, said, "Look, I've got plenty of money in the bank. I've got this, I've got that. My house is in order, but I just can't protect my kids. I just can't protect my family from this. If they get it, they get it." And I said, listen, brother, the first thing you need to do is stop listening to those podcasts. Stop watching them. I want you to not watch the news for 5 days. Go out on your family farm. I want you to fish. I want you to chop wood. I want you to get out and get some recreation. Because his whole life, and that's the problem, is that people's rhythms have been very upset. Their lifestyle of recreation, whether it's playing pool or video games with their friends, or whether it's going to the gym and having that opportunity, however you recreate, and people just aren't really doing that anymore. And so their whole rhythm of life is just completely disrupted by this. And this is a part of the old adage that's come back around now that this has hit us, and it's the idea that the cure is worse than the disease itself. And I think we're starting to see that with the explosion of mental health problems.
Well, Charles, that's going to bring me to a couple things. We've got questions coming in and a couple things I want to ask you. So I'm going to hit you with a couple at once. To mask or not to mask? That is a question. Also, read online or saw online a doctor talking about if you're freaked out thinking that you have the coronavirus, that if you took your temperature and had one of these little pulse ox, whatever it's called, pulse ox, get it at Walgreens, CVS, and your oxygen's fine, that chances are you're not infected. Talk about those three things for me.
Okay. We spoke about mask last time. I think that's a personal decision to mask or not to mask. I think if you're, quote, social distancing, you don't need to mask. I would say that those folks that are in the hazardous categories should probably be wearing a mask, but I'm not one of these folks that's going to say you're not going to get it. The virus can be on surfaces. They can go through your mucous membranes of your eyes. If it makes you feel better, fine. Now, you're talking about fever and the pulse oximetry. You've got to remember, let's say you do take your temperature, you don't have a fever, you take your pulse ox and it's 98, 99%. Remember, 50% of the folks are asymptomatic. So you may have it and you just don't know it. But if you've got some sort of symptoms and you take your temperature and you do your pulse ox and there's normal, but you have symptoms, I'd say stay at home because you have symptoms. Once you get a fever, you're not going to need a thermometer to know that you have a fever. And if your oxygen level is dropping on your pulse ox, then you've already got a serious case of it. And you're going to be having other signs or symptoms.
So what's before people go buy one and freak out, what's the normal readings they should expect to see?
That is so variable. It depends on your level of physical activity and your level of physical fitness. Typically, the normal is 96 to about 99. They take mine. When I go in, I've got 98, 99%. There are people walking around right now with a pulse ox of 60.
That don't have any problems. They're
like smokers, or they have COPD or something like that.
Well, let's get to a couple questions. One that came through is Heather wants to know that if sunlight is a way of killing the virus, how come Florida is not seeing a decrease, or somewhere like New Orleans where it's hotter?
It's not the heat, it's the sun. And as the summer progresses and the days become longer and the sun is higher in the sky, you'll start seeing a decrease. And there probably is a decrease anyway, just based on person to person, like they call it community spread, simply because the sun will kill the virus when folks are out. That's why you see these photos down in Florida on the beaches. It's probably not going to be a big deal since it's in full sunlight.
Here's this is whenever I'm doing asking questions, I try to be Switzerland and stay neutral and everything. So I want to get an answer to this because it is pretty funny the way it's being circulated on the internet. But did Donald Trump recommend that you inject Lysol into your body to kill the coronavirus?
I'm gonna say I have not listened to any of his briefings, so I don't know what his exact words are. I know it's been spun that he was actually meaning ozone therapy, which is used frequently for antiviral and antibacterial treatment. In fact, there was a study in Spain where they treated 10, I believe it was 10 or 12 seriously ill folks with ozone, and they recovered fully. Um, I cannot comment whether he said inject Lysol or not. If anyone suggests drinking bleach or injecting Lysol, just don't do it.
Well, you would think that people in general would have enough common sense not to, but hey, look, if some people are going to rib each other, you got to be willing to give and take, and he's definitely taking it right now. What if people are basically, I think a good way to approach this would be, instead of people fearing infection, because some of the questions are, for example, am I infected? How do I know? Or what is my risk of infection? These are some of the questions that I'm getting. How would you answer that?
Are you infected? To be totally blunt, you don't know unless you get tested. And in North Carolina, they have decided not to test people unless they have symptoms. If you have symptoms, more than likely you have it, and you don't really need a test. And there are just too many people to go randomly testing folks that don't have symptoms. So the real way that you know you have it is to be tested. But you're not going to get tested unless you have serious symptoms. And if you have serious symptoms, you know you have it. How do you get infected? You're infected by the common way a cold is spread, on contact surfaces, touching something where the virus is viable, then touching your nose, touching your mouth, touching your eyes, having it spread in close quarters, less than 6 feet away, and someone has the virus and coughs or sneezes or spreads it some way like that. That's really the way you get it. It's not foodborne. It's not. It doesn't appear to be bloodborne. It's just a cold virus.
So let's talk the odds, because maybe that'll help people grasp a little bit of what you've been saying all this time. So see if I get some of my numbers right. So you are saying 82% of people will not even know they had it. So if you were able to test everybody in the country right now instantaneously, 82% of them would have had it and would not have had any symptoms whatsoever.
No, that's not exactly true. If you don't know, if you tested 80% of the US, how many would have it. What I'm saying is that based on the other studies, 82% of folks either have mild symptoms or no symptoms. And if you take the number of folks that have been tested positive based on the antibody studies from USC, from Stanford, from Iceland, from Sweden, from Japan, from South Korea, anywhere from, or even the New York study, anywhere from 40 to 80 times that number are the number of folks that have been exposed. So if you've got 1,000 people who test positive for it, based on those studies, somewhere between 40,000 and 80,000 of the people in that area have been exposed and have antibodies to it. Something I just saw today was on a Navy ship, and I don't remember what it was. 850 soldiers. Of 850, 0 were symptomatic, and every one of them had antibodies.
So the entire ship had passed it around.
The entire ship.
And nobody got symptoms in the entire process.
And evidently no one had any symptoms at all on this ship.
Wow. So,
again, the Navy, they're young and healthy.
So how much of the news is fake news?
I'm not sure I would use the term fake news. I'm not sure any news agency, at least in the U.S., is out to be
I,
propagating.
I only use the word fake because that's what's recognized right now. Let me use the word false or exaggerated news with the intent on our fearfulness.
I think exaggerated is an excellent term. And I think, in my opinion, 80% is probably exaggerated.
Well, that is creating a huge problem because people, one of the questions that I wanted to hear your input on is, why can't we all just get along? Because people are divided. They're insulting each other. They're all over social media posting their rants, and kind of like this thumb muscle's getting like really strong from hitting the unfollow every time somebody starts something like, well, here's my rant on this. I'm like, whether I agree or not, stop with the rants, relax. It's like we're bombarded so much with so much negativity, and then we're breeding it and spreading it. And like a little earlier today, I interviewed one of my black belts from 1996, Byron Branham. He's a counselor in Virginia and retired out of the Navy, 27 years. And one of the statements he made at the end is, calm breeds calm. Well, if that's the case, negativity is definitely breeding negativity, because I see people that should be friends that are attacking and insulting each other like crazy. Is there some sort of phenomenon that is present that's causing this? What's going on?
Yes, it's called fear, isolationism, and the fact that they're bored. They have nothing else to do.
So you don't have anything to do, so you pick fights.
Exactly. And you spend all the time on social media, and you read the news that you would not normally read because you would be working from 8 to 5.
So here's another question. When you exercise outside, is 6 foot enough distance to keep, or will the virus spread further outside where there is more? And I'm not seeing the rest of it.
No, it's you can exercise all you want to outside. In fact, it has been proven it's an infectious disease paradigm that the disease is spread. Any infectious disease is spread more in close quarters and inside. Get outside and go exercise.
So if you had overall advice, and guys, any other questions you have for Dr. Rawlings, we've been fielding them as they're coming through. Even if you're coming in late, go ahead and ask. It might be something we might cover again. We're trying to separate the facts, the fiction, and the fear, which is crazy. I mean, I know it's unprecedented and we've never seen anything like it, but when I say I've never seen anything like it, I've never seen anything like it. Like, it is nuts watching people go bananas over every little thing. And Charles, what I like about talking to you is for you guys that don't know, is Charles actually contracted and recovered from the coronavirus because he went to New York after I told him not to, but he wasn't scared and went on a quick trip to New York, came back. We talked a couple weeks later and he's like, "Oh, I've already had it. Like I had a fever blister or something. Like, it was no big deal." Charles, remind us what happened about that and what the recovery was like.
Sure. About a week after I was exposed, I'm assuming at some point, I developed a headache. I had fever for 2 nights, probably up to 102, maybe 102 and a half.
Did you keep the fever during the day? Or just at night?
It was mainly at night, I think, I would say. That's when they typically spike. I had some body aches after a while. I could tell when I was running that my wind was a little bit off. I got a sty on my eye, which I never get. And then it left after about 3 or 4 days. It took me about 3 or 4 more days, maybe 5 days, to get back to running where I didn't notice my wind being less, and that was about it.
So I remember this. We talked about this about a week ago, and I said what were your symptoms? And you told me, and I said, were your symptoms typical? And you said, no, because most people don't have symptoms. I thought that was a great answer.
That's true. I am atypical because I had symptoms.
So what do you think, where do we go now? What do you think should happen? I know there's, I understand both sides, and I try to be good at differentiating between craziness and common sense. There are people that are adamant that we open right now and jump back into everything full power. There's other people that are adamant that everything stays closed down, that you're a freaking idiot if you even think about going outside. And then you've got those people that are probably a little more like me that are in the middle, thinking there's probably some common sense we could invoke that would allow this to move on. What do you think we should do? Where do we go now?
Well, like I was saying at the beginning, just flatten the curve. It's already happened. We're not going to overwhelm our medical system. What we're doing is we're just postponing the deaths, which will be tragic, but people are going to get this virus. They're going to get it. And those folks who are at risk, they will be deaths. What there has to be now is a reopening. Like I said, I don't think you need to throw everyone into the big pond immediately and let the riptides and sharks take them. What it has to be is sort of a bridge where we have set up methods, maybe keeping them at home or whatever it takes to protect those that are most at risk, the nursing home folks, the elderly, the immunocompromised, those types of folks. Everyone else, they need to go out and work. That everything else can be opened up. I don't have a problem with social distancing. I think that's a good idea, especially in the cold and flu season. But the economy has to open up, or we're going to be seeing many more deaths and other problems associated with the isolationism, the poverty, the closing of businesses, all that's going to be coming in the next 3 and 4 months.
Well, one person just asked this. For someone who has asthma and COPD with low pulmonary function, how cautious should they be? Should they continue to not go into public at all? As long as she wears a mask, will she be okay?
I would tell that person to do strenuous hand washing, hand sanitizing, keep 6 feet away from folks, and wear a mask.
Another one, what are your thoughts are if somebody has had it, will they be protected from getting it again? Some reports are on both sides of this, and she's in healthcare.
Well, she knows traditionally, if you get it, then you will have some sort of immunity to it. Is it 6 months? Is it 2 years? No one knows at this point with this virus. It's a coronavirus. It will mutate. It has mutated. I think they've counted 30 mutations. So it probably will be with us. It'll be a cold virus. But for the most part, you will have some sort of immunity to it.
So earlier, and guys, if you have any more questions, we're about to wrap this up unless you have a question. Dr. Rawlings has done a great job fielding everything that we've been doing as usual. Charles, this is very interesting to me. What you taught, 2 things. Sweden, that's very interesting to me. And something you said about a 70-day cycle on the virus, and something that, and then if that is true, how far are we into this, and when would this turnaround time be? Okay.
Well, Sweden, as most people know by now, has gone a route that most countries should have taken. They are doing social distancing, limiting crowd size. They have not canceled schools. They have not closed businesses. They are obtaining herd immunity. I believe, looking at the latest report, that Stockholm will reach herd immunity as of this week, which means that the virus itself will be seriously hampered in spreading. It doesn't sound like they did a great job of protecting their those that are most likely to get it. I think it got into their nursing home, and that's where the vast majority of their deaths occurred. I think that when the U.S. opens up, that's the population that should be protected: the nursing homes and the elderly. And as for the 70-day cycle, it was just an interesting paper that I read from, I believe it was an infectious disease fellow from England, if I remember correctly, where he said this is typical of most viruses. It's a 70-day cycle. The epidemic starts, it peaks, and then it peters out. And 70 days would be basically starting now, and that's what you're seeing in the U.S. Case numbers have plateaued and are going down, as have deaths.
But this is 70 days in the United States or 70 days since origination?
Well, if you check origination, it was in China, and they're almost back to normal.
Well, like, okay, let me ask you a personal question. So my mother-in-law is in a assisted living, and we've been really careful, and only my wife has been over to see her. We stood outside on her birthday. Is she safe to come to our house? Or we safe, or is it dangerous because should she get something from us, she would take it back there? Or should she really remain isolated like she has been?
I think she should remain isolated. She's part of that population that should be isolated until there's a vaccine or a good treatment.
And what if that's a year from now?
Then she would be taking her chances otherwise, until and unless there is good penetration of the virus, so that there won't be virus that's contagious in folks, and it won't be laying around on surfaces.
Okay, I'm double checking to see if we have any other questions. Any final thoughts you'd like to put in today to everybody watching? And guys, if you're joining in, we're on our Project 49. We're in the Project 49 studio today. And subscribe to our channel if you haven't already. We're doing lots of great interviews like this, posting all types of different information on our YouTube channel. Today, we're streaming live to Facebook and YouTube. We're talking to Dr. Charles Rawlings, and we've been trying to separate some of the facts and fiction from the fear, and, teach us all to get along a little bit. Charles, any final thoughts? Oh, my wife corrected me. It's a retirement community, not assisted living. Does the same still apply?
No, that makes it a little bit different. If that means that that the population is a little healthier in a retirement community. Just being out of an abundance of caution, I would still keep her isolated for a while. But again, if you were to pick her up in your car, take her to your house, and that's the only outside contact she had, you probably would be okay.
Okay, good. Well, guys, if you're joining us late, this is Alan Branch. Our new YouTube channel is Project 49, and the purpose of the channel is lifespan, longevity, and lifestyle for people over 40, and trying to learn to take care of everybody. Because as a culture, Charles, would you agree that after age 40, people in general are on this kind of decline in all areas? Their health, they gain weight, they lose muscle mass, they're more depressed. So we're trying to sort of reverse that and send them the other direction. And that's the purpose of Project 49. And we appreciate you coming on and helping everybody sort through some of the madness.
Well, thank you, Alan. I appreciate the opportunity, actually. But
so guys,
my parting words would be, just don't fear this. Don't necessarily listen to the fear mongering and the exaggeration from the news. This is what, solitary confinement is like. This is why people go nuts in jail when they're in solitary.
Well, I personally am very happy that we have the internet, Zoom, Facebook. At least I can still talk to everybody and train people and still stay connected, which I think earlier today, our therapist that came on said that staying on a schedule and staying connected were two of the most important things you could do.
I agree completely.
Well, man, thanks again, guys. Thanks for watching. I'm Alan Branch. This is our studio of Project 49. Today we were talking to Dr. Charles Rawlings. If you joined in late on our live broadcast, please be sure to go back on our YouTube channel as Project 49, no spaces. Subscribe to our channel if you can. Go back and catch the beginning of the video. Dr. Rawlings gave us some great information. Charles, you're the man. Thanks a lot. We may be back on another week or two to answer some more questions, but until then, I know you're going to stay safe because you're smart and that's what you do. And we'll look forward to seeing you soon.
Sounds good. Thank you, Alan.
You got it.